Good morning. Welcome to Frank Talks. We are so happy to have you here, and we're grateful for your investment of time. We would like to first say thank you to our sponsors. This is the reason why we're able to have Frank Talks free of charge. And first, I'd like to say a special thank you to Williamson Medical Center. They're our sustaining sponsor. And Nicole is here. I'd like for her to come and tell you a little bit about their Valentine's card that they have for you.
Good morning, everybody. So you'll see on your chair that you've got a Valentine's Day card and a couple treats. Hope you enjoy them. As most of you probably know, February is Heart Awareness Month. And we recently found out that Williams Medical Center got #1 in the market for heart attack treatment. So we're very proud of that. And so, in February, we always make it a point to do some education. So you'll see there's a poster inside of it that gives you just more information about the signs and symptoms of heart attack and what to do. So please hang this up in your office or at home or wherever you find convenient. And we thank you so much.
Thank you, Nicole. We appreciate it. Let's give them a round of applause. We have a video that we'd like to show you for just one moment.
My name is Pat Rudd.
I'm Robert Ring.
I started having chest pains. I didn't know I was having a heart attack.
I couldn't get my breath. They called the ambulance.
We literally bring the emergency room to the patient.
By the time they got me here was a specialist waiting for me, and they rushed me upstairs and, quite frankly, saved my life. That's the only reason I'm still here today.
With follow-up care, I've been doing fine. If anything else happens to us, we're going back to Williamson Medical Center.
Thank you again, Williamson Medical Center. We also have a presenting sponsor, and that is Renaissance Bank. We are so grateful to Harrison and Tony and Diane for your support in providing Frank Talks for the community. And Harrison, are you here? Come on over so we can say hi to us.
Thank you very much, and we're offering a free lockbox for anybody that comes in to open up an account. So it can be like a checking, savings, a CD. So we're offering for any size lockbox. So write it down here at the new office down here across the street from the police station. So you all come by and see us.
Thank you, Harrison. We appreciate that. Let's give them a round of applause. Thank you. Now I'd like to introduce Nancy Conway, who will share with us in our Did You Know segment. Thank you, Nancy. Nancy's one of our longtime board members with Franklin Tomorrow.
Good morning, everyone. You all look great, and I have several people that are going to be watching as to who raises their hand with the answer to the quiz question first. But I'll give you just a little preliminary and then let you know what the question is. First, in commemoration of February being Black History Month, today we honor the memory of a prominent Franklin African American. Now, the question: who established and operated the first hospital in Franklin for African Americans? Robert, Alan, you all decide.
Well, Robert was first, but Alan, you. Together.
Dr. Charles Johnson?
Correct. The answer is Dr. Charles Johnson. Dr. Johnson's full name was Dr. Charles Claudius Johnson. He was born in 1886. Died in 1966, and his hospital opened 1948 on Columbia Avenue, and it was somewhere, I just remember pictures where it was a red brick building, his home was next door, was a red brick house on Columbia Avenue, sort of, where Harrison's Bank is today, in that area. And just for you to know, yeah, it's Harrison's Bank, right? Okay. In 1958, Johnson Elementary School was named for Dr. Johnson. And then some of you here today know Mary Mills, a retired educator and county commissioner and hospital trustee, etc. Well, Mary is the niece of Dr. Johnson. And thank you all so much.
Thank you, Nancy and Alina. Alina, you're going to something interesting today as well, the dedication of the Suffrage Museum. Tell us a little bit about that. You and the mayor and Alderman Peterson and Mr. Blair are going. Tell us a little bit about that.
Franklin Elementary is having the grand opening of their Elementary Suffrage Museum, and it will be at 10:30, so please forgive us for slipping out just a little early. We're real excited that the third and fourth graders have been working very hard to recognize this monumental time in history.
Thank you so much. This is a busy month with a lot of activities, and we'll review some of that at the end of our program. But it is a Heart Month. Thank you to Ted Dreyer, who brought us some little books on the back table there. The Loving Book by Musi the Cow program. I'm just going to say, with the chocolates on your chair and the Musi book, it's Valentine's Day at the end of the week. It might be taken care of. I don't know what anybody's expecting, but it's all good. So we appreciate that, and we appreciate Renaissance Bank donating an umbrella today that was the door prize. So it's going to come in handy this week is what I hear, don't you? It's going to come in very handy. Doreen? Oh, today is National Umbrella Day, Doreen told me, so that's good. That's good. We really appreciate all of you coming out on a rainy Monday morning, and what we're going to be hearing next is very important information about our community. Franklin Amaro has been involved in the health and well-being of our community for several years since we created a program called Get Fit Franklin. And Get Fit Franklin served as the representative with the mayor's invitation, Mayor Moore's invitation, to be part of the Healthier Tennessee initiative for many years. And we do quarterly Walk More with the mayor. And go ahead and put March 21st on your calendar. We're going to be doing our Walk More with the mayor. But the theme is, why only exercise when you can trashercise? So we're going to be trashercising in Franklin, and not only getting in our walk, but picking up and making our community more beautiful. So we're excited about that. But we've been working also as part of the Community Health Council, and we are excited to have with us today Chelsea Granderson, who's the Community Health Coordinator for the Institute for Medicine and Public Health at Vanderbilt University Medical Center, Brianna Gauchette, who's the Community Health Coordinator, Office of Health Equity at Vanderbilt University Medical Center, and Kathy Montgomery, Director of the Williamson County Health Department. And ladies, I ask you to come up. They are going to explain to you and present on the Community Health Needs Assessment summary. It's a summary because if they presented the whole thing, we would be here until 4 p.m. And it is very detailed, but we are excited to present these results today. And this microphone's a little hot, but I'm going to give it to you, and you can sit or stand.
I'm going to stand.
Okay.
Thank you.
Do you want the click?
Yes, I do. Thank you. Good morning, and thank you so much for this great opportunity to come and share some information with you. It's interesting because on February 2nd, 2019, we were in this room talking about the health indicators for Williamson County, and also coming up with some of the priorities for the county. So we're excited to share some of the data, and then at the end, share some of the things that we've been doing in this community. And as we talk, please be thinking about ways that you might be able to get involved and try to help us with some of these initiatives. So there we go. So just to kind of explain a little bit about our process, every local health department in the state of Tennessee every 3 to 5 years is required to do a community health needs assessment. That is looking at indicators that actually impact the health of our community, and especially among our low-income populations. We have been truly blessed in this county to have the expertise of Vanderbilt to assist us in this data collection process. So some of the things, for example, that you'll hear a little bit about today that we've pulled together is we look at leading causes of death. We look at those rates of chronic disease like diabetes and heart disease and cancer. We also look at the risk behaviors for our community, like alcohol and tobacco use, obesity rates, and so forth. And then finally, we couldn't do any of this without looking at our environmental factors. For example, access to healthy food, housing, pollution rates, and so forth. So we take all of that data and we actually do a pretty extensive review of that information. The second part of the data collection is really doing kind of an environmental scan. That is, that we pulled together a community health advisory council with all of these different agencies. You'll see Mercy Clinic, I know Mercy's represented today, our law enforcement, Veterans Affairs, to kind of help us devise a survey that we can put out, that we did put out through the community to kind of get some feedback on what our community, our residents feel like are the real health issues in Williamson County. So we did the surveys. We also went around to some of our stakeholders, and did some key informant interviews with our local mayors, with those local leaders in our county that have some great input on what our health topics or health issues are. And then we met with populations of folks, particularly at Mercy, at the health department, more of those low-income populations to kind of give us, we had listening sessions with them to give us feedback on what they felt were the key health issues in our community. So you're going to hear a little bit more about that. And so I'm going to turn this over to Chelsea, and she's going to start diving into the data, and then we'll share a little bit about what we've been doing in the county.
Thank you, Kathy. Good morning, everyone. So for our assessment, we do apply a lens of health equity, and we do that in a few ways, and Kathy has mentioned a few of them, but we really try to have strategic focus on low-income, minority, and vulnerable populations, and so we make sure that we target those groups through our assessment, and we also really made a good effort to gather data in multiple languages, and so for our assessment, we did gather data in both English and Spanish, knowing that that is a growing population in Williamson County. Here we have a summary of our methodology that we use for the assessment, and I'm not going to go through this slide in too much detail because we hit on it throughout the rest of the presentation. But as Kathy mentioned, we do have a mixed method approach, and so we've done an environmental scan of existing data and reports that were gathered by other organizations in the community. We do interviews, listening sessions, and we did do a broad survey, and then we had that extensive review of secondary data. We take all of that data to the Community Health Summit that Kathy mentioned was held in this room last year, where we then prioritized health needs for what the community should be addressing related to health. So just in terms of the type of information that we like to gather, we know that clinical care is only a small portion of what really impacts our health, and it's actually those social and economic factors that have more of an impact. So, and also the physical environment and our health behaviors. So this slide is just showing you sort of all of the different categories of information that we gather for our assessment, and we'll share some of that with you today. For our secondary data review, we look at a wide variety of indicators, all from publicly available sources. So we're looking at data from the CDC, from the Census Bureau, from Tennessee Department of Health, and a number of other sources, all with recommendations for what we should be looking at. So from the Catholic Health Association, which is a well-recognized organization that kind of provides guidance on how to conduct the CHNA, Center for Disease Control and Prevention, our IRS requirements, and then our Community Health Assessment Advisory Council also gave us input on the secondary data that we should be looking at. So we began that review with a summary of demographics and socioeconomic status in Williamson County. So in 2018, Williamson County had a total population estimate of 231,729, which was a 26% increase since 2010. About 27% of the population is under the age of 18, and 13.2% are 65 years and older. 58% of the residents are over the age of 25 have a bachelor's degree, which is higher than the Tennessee value of 26.1. The median household income in Williamson County is a little over $100,000, while in Tennessee, there's a median household income of $48,000. Williamson County lacks in diversity when compared to Tennessee and the United States as a whole, with just over, with almost 90% noted as white and 4.8% identifying as Hispanic. Unfortunately, 4.6% of the community lives in poverty, and we know that poverty is more prevalent in some geographic areas of the county compared to others. So we can see on this map from the U.S. Census Bureau a distribution of rates of poverty in the county, with the darkest blue areas indicating the highest rates of poverty, with some up to 14.4%. Another social determinant is education, and fortunately, Williamson County has higher graduation rates than the state and the nation, and the trend is continuing upward. This line graph shows us that the county has consistently had higher graduation rates when compared to the state and the nation, with the highest percentage being reported in 2017 at 95.5%. As we think about the physical environment here in Williamson, we look at housing as a key component, and this map is showing us the areas of the county that are cost burdened, meaning they spend more than 30% of their income on housing cost. And we can see on this map the distribution of that, and some areas are having more than 20% of that area being cost burdened. Most people gain entry into the healthcare system through insurance coverage, and though uninsured rates are at historic lows, there are still populations with no access to insurance. According to county health rankings, Williamson County's uninsured rate is 5%, which is a little over 11,000 people in the county. But access to care not only depends on insurance coverage, but also on the availability of providers. So we look at provider rates to tell us the number of providers that are available to the population. And so we can see here that Williamson County is doing relatively well in the areas of primary care and dental care when compared to the state of Tennessee and what is considered the top 10 counties in the country. But one area for improvement is in mental health care providers being available to the community. Between 2012 and 2016, there were more than 5,000 total deaths in Williamson County, and this slide is showing us the 10 leading causes of death and what percentage they represent. So we can see that cancer and heart disease make up by far the largest portion, with about 45%, which is not unusual when we look at the rates compared to Tennessee and the United States as a whole. And with the growing older adult population in Williamson County, this contributes to a larger amount of Alzheimer's-related deaths compared to the United States overall. Other leading causes of death include accidents, strokes, lung disease, suicide, diabetes, influenza, and kidney disease. And altogether, these 10 leading causes make up more than 3/4 of deaths in Williamson County. Here we have a comparison of cancer deaths by type in the county and in Tennessee, and we can see that breast cancer is the leading cause of cancer deaths, and overall, Williamson County has greater rates of deaths from prostate, breast, and skin cancer when compared to the state of Tennessee. However, the rates for lung and colorectal cancer are lower than the state as a whole. Heart disease is generally declining, but we know, as with many other indicators, some of which I'll share in a minute, there are some racial and ethnic groups that experience this condition at higher rates than others. So looking at this graph that illustrates the racial disparities that we see, we can see that Blacks and African American populations have the highest rates of mortality from cardiovascular disease, and the heart disease death rate for Blacks and whites in Tennessee is actually higher than what we see in the United States as a whole. From 2013 to 2018, 143 people died by suicide in Williamson County. In 2018, the rate of death by suicide was 12 people per 100,000 population, and we know that 94% of these deaths were among white residents. In this graph, we can see that deaths by suicide are more frequent among men than women and mostly occur between the ages of 35 to 64. The United States is not a leader worldwide when thinking about infant mortality. In fact, there is a World Factbook that ranked us 55th behind much of Europe and Asia. And we can see here that Williamson County's infant mortality rate, while significantly better than what we see in the state and the nation, this rate has increased slightly since our report in 2016. But overall, we are doing better than what we see in the state of Tennessee and the United States as a whole. Behind birth defects, preterm and low birth weight are the leading causes of infant deaths, and Williamson County is doing relatively well in this category as the percents for very low and low birth weight are better than what we see for the Healthy People 2020 goal. However, we can also see that there is a distinct disparity that exists between this outcome for Black babies and white babies. Teen birth rates is also an indicator that is declining across the United States as a whole. But in Williamson County, we see a large racial disparity that exists, with Black babies having a teen birth rate of 13.3 per 1,000, and whites having a teen birth rate of 1.1 per 1,000 in 2017. So a significant disparity there. And I'm going to turn it over to Brianna to share with us some information about health behaviors.
Thank you. All right, good morning again, everybody. So now to talk about some behavioral risk factors. So cigarette smoking is the leading cause of death, a preventable disease and death in the United States, accounting for more than 480,000 deaths per year, So moving on to this next graph, the United States rate is 15.5%. Compared to Tennessee's 22% and Williamson County's 15%. And these numbers are all higher than the Healthy People 2020 goal of 12%. So it's important to continue making strides to reduce these rates. And for excessive drinking, it's also a risk factor for a number of negative health outcomes, making it the third leading lifestyle-related cause of death in the United States. So 14% of adults in Tennessee report drinking in excess, compared to 17% of adults in Williamson County. So in an effort to lower this rate, the state recommendation for Williamson County is to get 77% of adults who currently drink in excess to stop drinking more than the daily recommended average. And obesity, we know, is linked to many chronic diseases. And Tennessee is doing worse than the United States average, with 32% of adults being classified as obese, and the Williamson County rate is 24%, so that's lower than the state and United States average. And a health behavior often contributing to obesity is a lack of physical activity. And the percent of physically inactive adults in Williamson County is 20.8% compared to 30.1% in Tennessee. So we can see that these rates coincide with the percent of obese adults. We know that mental health is a huge component of overall well-being. So poor mental health days are defined as the number of days within the last 30 days that someone experiences mental health complications. So Williamson County individuals report 3.8 poor mental health days, which is lower than the state average of 4.5. And so this slide shows the percent of adults with any mental illness who received mental health services in the past year. So related to how we know that mental health is a huge component of overall well-being, we see that 43% did receive mental health services, and 56.8% did not receive mental health services in the past year. So for primary data methodology, we went through a little bit of this earlier. So we had our environmental scan of 6 different county level reports. And then we conducted 19 key informant interviews. And we interviewed community leaders from a variety of different sectors that represent different populations, including government, school system, nonprofit organizations, businesses, healthcare, et cetera. We conducted 3 community listening sessions, and one was conducted in Spanish. And in those, we gathered feedback from community members about the assets, concerns, and possible actions moving forward. And we also received over 1,200 community survey responses, and those were administered electronically, and they were available in Spanish and in English. And throughout all these different data collection processes, the main topics discussed were quality of life, community assets, obstacles, and priorities. So for the assets from our primary data results, these are looking at the results from interviews and listening sessions. So the top assets included small town culture, faith-based community resources, and a strong education system, among others. And for top concerns, those included child development and teen stress, affordable housing, mental health, and substance abuse. There was a question asked about if we had a magic wand, what would you focus on in order to fix in Williamson County? So the top results of that question were mental health, substance abuse, resources for all, housing, and health literacy. And then for the top obstacles, those were stigma, lack of awareness, civic engagement, education, and inability to serve specific subpopulations. And these were the results from the community survey. So the topics included health status, children's health, access to care, mental health, and various social determinants of health. And the key findings were that there's a general lack of awareness of available resources, and there was also a desire for more safe parks and greenways. We found that 77% of respondents indicated a lack of affordable and accessible housing, and we also found that 94% of respondents indicated that mental illness, alcohol abuse, and drug abuse are a problem. Okay. So we took all of the data that we just presented to the Community Health Summit, and the purpose of the summits were to solicit input and take into account the broad interests of the community. And at the summit, invitees, those included participants in interviews, community listening sessions, community members with expertise in public health, additionally, leadership from VUMC and Williamson County Health Department and other community stakeholders were present. So we presented primary and secondary data, and we used that to have informed table discussions, to conduct a needs prioritization, and we also had a lot of group discussions throughout. And what we found from the summits were these 4 prioritized needs. So those came out to mental health and suicide prevention, health education and prevention / resource availability, substance abuse, and affordable housing. And sorry, real quick, so these are the covers. On the left is our community health needs assessment, and on the right is the implementation strategy, which is a VUMC-facing document that's required by the IRS. These are posted online on the VUMC website, and so that link will be up at the end for you all to take a picture, write down in order to visit, if you want to look at all the data and all the needs prioritization right now. And then finally, just to explain the next step after we have done all the data collection and the needs prioritization, the next step is a CHIP, which stands for Community Health Improvement Plan. And the CHIP essentially is a community-facing document that outlines the action steps and the goals in order to address the prioritized needs. So for Williamson County, again, those 4 identified needs were mental health and suicide prevention, health education and prevention and resource availability, substance abuse, and affordable housing. So those are put into priority areas. We give them goals, objectives, intervention strategies, action steps, and in the end, we have plans for evaluation and monitoring. And so now I'm going to pass it over to Kathy to talk a little bit about those goals and interventions for those priorities.
Okay. Thank you, Vanderbilt. I appreciate that. As Chelsea and Brianna mentioned, mental health and suicide prevention is definitely one of the areas that were chosen as a priority for our community. And I just wanted to share just a little bit more data with you because we had to kind of dive down into the results to be able to figure out what strategies and goals and things like that we wanted to put in our community health improvement plan. So Chelsea mentioned that from 2013 to 2018, we had 143 completed suicides in Williamson County, and I will report that the youngest was 14. We've been pulling information from our Williamson County Communication, the 911 call center, to look at suicide ideations, to look at threats and attempts and so forth. And I will report that from July 1st, 2017 to December 31st, 2019, that's 2.5 years, Williamson County received 706 calls for service for threats of suicide. In that same time frame, we had 284 suicide attempts in Williamson County, and 77 of those attempts were among people 25 and under, and the youngest was 11. Okay, and more than half of the attempts were drug overdose attempts. So one of the things that we've been trying to rally around, and we're so thankful for Mayor Ken Moore for pulling together a task force to start having these discussions and having these conversations. So one of the things that this task force is working on is to try to educate our community about signs and symptoms of suicide. We've got to start having these conversations. We've got to start reducing the stigma of suicide and having discussions. One of the things we're working on is with the Tennessee Suicide Prevention Network, and it's an evidence-based practice called Question, Persuade, and Refer, QPR training. So we've written a grant through our friends at Vanderbilt. We'll know on Friday whether or not we're funded. On Valentine's Day, it's gone through Franklin tomorrow, the grant has. And we're looking to try to certify at least 15 individuals, and some of those individuals in Spanish, to go out and to be certified in this QPR training so that we can go to schools, to churches, to local civic groups to try to have these conversations and to try to raise the awareness of suicide. We're also working with Williamson Medical Center and with local law enforcement to try to identify some places for referring those who are in crisis, for having a place to take them instead of having people that are suffering from mental health and taking them to jail or to the local hospital. So we're trying to get them into some kind of service of care. And then also trying to create a clearinghouse, trying to create that community resource. Do people know where they can go for mental health access? Do they have, the information that they need? So that's another thing that we're trying to work on as well. The community resource availability, this actually fell out in our 2015 community health needs assessment as well, that we didn't have like a one place to go or one-stop shop, so to speak, for where we could access community resources. So we've been working with United Way of Williamson. I don't think it's United Way of Williamson anymore. I think it's United of Greater Nashville, yes, pardon me. But they do have a 211 system that has all kinds of resources available from mental health to rental assistance to where you can, what doctors or primary care providers are available in our community. So if you are an agency that has resources available for the community, I encourage you, please go into that 211 system. You can add your agency information for free. If you've already added it, go in and make sure that it's updated, because we're going to start an approach where we're trying to get everyone to fill in that information, and then we're going to be working with United Way to kind of deploy that out to make sure that the community knows about 211. So we've already started that endeavor. The third priority area was around substance misuse in Williamson County. And I look to Kim Tyner, who's head of our Williamson County Anti-Drug Coalition. Some of the issues that we've really seen, and when we looked at the data and we looked at school surveys and we looked at opioid addiction and so forth in our community, really one of the biggest things that we see in our local schools is on vaping and marijuana use. We really kind of thought it was going to be around substance use or prescription drug use, but there was a survey that was conducted. There's a survey conducted every other year among school-age children in 8th, 10th, and 12th grade. And the results that we saw, it looks at risk behaviors and so forth, and the results that we saw were really that students were using e-cigarettes, and the use of marijuana was definitely more prevalent than anything else. So we've been out. I looked at our health educator, Brittany Laborde, who has been out with multiple folks in multiple schools. I can tell you in the month of October alone, they talked to 7,500 students throughout Williamson County about vaping and about those issues. They've been talking with school-age parents. They've been talking with church groups and so forth to really get the word out about what to look for. So that's been an area that we're really focused on, as well as working with the Anti-Drug Coalition. I don't know if you're aware of it, but the Anti-Drug Coalition has been around since about 2012. And they're funded by the Department of Mental Health Services. But one of the things we've been able to accomplish in this community is that there is a permanent drop box in just about every local police department in our county. So in Nolensville, Fairview, Brentwood, Spring Hill, so forth, so that you can go, and if you've got unused or unwanted or expired drugs, you can go drop those anytime. Okay, and then we do drug take-backs at least twice a year, as well as Kim has lock boxes. So if you have teenagers, if you're a grandparent with teenagers that come to your home and so forth, and you want to lock up some of those medications, please see Kim. She can raise her hand back there in the back to access one of those lock boxes. The other thing I will tell you is that sadly we've had to start promoting Narcan training, so they have naloxone available. So if you'd like to talk with her afterwards about possibly having a training, maybe for your agency or even a personal training, she can definitely help you with that. And finally, affordable housing. So I will tell you, the city of Franklin does a phenomenal job with looking at affordable housing for especially not only our low-income residents. I know Franklin Housing Authority is present today. They've done just a phenomenal job at this, as well as looking at senior resident facilities for our aging population. But what we really want to do and what this group wants to do, we have work group members that sit on this, and Mindy Tate is definitely one of those leaders for us, is to go out into some of our other areas of our county, like Spring Hill and Brentwood and so forth, and start having these discussions about affordable housing and how we can make this, available for more than just Franklin residents. And then finally, just looking at our walkability plans, making sure that when new construction's going in, that we're including sidewalks, bike trails, things like that for our residents to be able to access. So I've given you, we've given you a lot of information today. Here is our contact information. If you have any questions, do we have time for a little Q&A session? So if we have any questions from the group? we're more than happy to try and answer those.
Great. And we're trying to use this one mic so that we have everything recorded. We will be posting this on our Facebook page, but also our website, and this PowerPoint presentation as well, so you can pull information from that. But let's see if you'll come up and we can get a few questions. If there are any questions from the audience. Anybody have a question? Come on, stand up. That's as far as I can go.
That's all right. You had 1,200 people respond to the questionnaire. How many were in the sample group total? And were they randomized, selected, and were the interviews face-to-face or filling out a questionnaire?
Our total sample size for Williamson County, I believe, was a little over 1,300. So that includes the survey, the people who attended our listening sessions, and the interviews. And the interviews were conducted face-to-face with individuals from community organizations, leaders, and other key informants that participated in the interviews. And then there was one other piece of your question. Randomization. So in terms of this survey, yes, it was distributed electronically through our various networks connected to our Community Health Assessment Advisory Council and others. And in terms of the listening session recruitment, we partnered with community organizations to do that recruitment. So it was whoever would confirm and show up to the listening sessions.
I wanted to ask, just to reiterate, so what's next? And you've got a room full of people here who've come with interest to hear this. So from each of you, what's next? What should be next?
Well, we've been utilizing our Williamson County Health Council to be able to define what should be some of our strategies and our objectives. Our Health Council is made up of various agencies and so forth that are represented. So they come, we meet the first Wednesday typically of every month, usually at Franklin Housing. And we divide up into work groups, and we, discuss what's happening, what's been happening. We're still collecting data. We're evaluating the impact. We're talking about those strategies and so forth. And I will tell you, the data collection took about a year to do, okay? And we've been very strategic about coming up with what are the plans that we're going to do. For example, one of the things I didn't mention, most of our suicides occur during the months of June and July, which was a little eyebrow raiser for me. But most of the attempts for suicide occur in October and November, and I'm just using that as an example. So when we try to be strategic about when we're going out and we're having these conversations with folks and these civic groups and church groups and so forth, we're really going to try to be very strategic about doing it during those months, or if we do any kind of community outreach, it will be done during those months when we see the prevalence a little bit higher. But I invite you, if you're interested in being part of our Health Council and working on one of these work groups, please see us afterwards, and we'll be happy to take your name and information and invite you to those meetings so that you can be part of it. Anything else? I think they're good.
I also want to ask, and maybe we'll go back to that vaping slide. We had a presentation a couple months ago at the police department as one of our Frank Talks, and we had a great turnout for that event because it's really becoming an issue, and it is becoming, I think, we know the entry point for then the development of some substance use disorder, or can be. So what are some specifics, and if anybody wants to talk about just being concerned about, Brittany, I don't know if you want to talk about the groups you're talking to and how to make that accessible to the general community.
So we currently present our vaping presentation at a lot of the schools throughout Williamson County, primarily at the high schools, but we're also in some middle schools as well. We're trying to get more awareness to parents. We have plans to work with Franklin Special School District to record a vaping panel similar to what we did with Frank Talks, but just to get the word out for parents to know what to look for with their children. And what these devices are easy to hide, and so sometimes parents aren't aware of what they look like. And just getting the word out to the public and even to the kids about the dangers of these products, because I think there's a misconception that these products are healthier than cigarettes, but they're all unhealthy and dangerous. I've done the presentation in as short as 30 minutes, but typically it's about 45 minutes to an hour.
And the presentation, the recording that Brittany was talking about, is going to be a little bit along the lines of TED Talks. So we have a panel of folks. We've not had great success in getting parents out to our presentations in the evenings during a school week, as you might expect. But what we're going to do is Brittany will do like a 10 to 15 minute introduction about vaping. We have a pulmonologist from Williamson Medical Center that's going to be on the panel. We also have a school resource officer who's going to be talking about the number of citations that are actually issued to our students, unfortunately, in school. And then also we're trying to get one of our judges, Judge Guffey, to sit on the panel as well to kind of talk about what the ramifications are when these children continue to get citations and and what impacts it might have on them. So those will be posted on the Franklin Special website, as well as Williamson County Schools and our website as well.
Any other questions? Come on up. Let's see how far we can reach, Karen.
Thank you. I just wanted to thank you all for the breakfast last month. It was just great to be invited and be a part of the community. And speaking from an education realm, when you have these conversations about vaping, are you also including students in those conversations as to learn from them about why they choose that, thinking about their overall health and well-being, because that's who your audience is, and to learn from them as to why they choose to go that route?
I'm going to let Brittany start.
So in the schools, sometimes the presentations are to a large group of kids, but sometimes it's in a smaller group setting. And a lot of times in those smaller group settings, we're able to just verbally survey the students and ask them questions like, what's the maximum number of pods you've heard kids smoking? Where are you doing this? And they get really candid when it's a smaller group, especially if they know that I'm not going to be busting them for it. But we hear a lot of what they're saying. And it's scary to hear how much these kids are smoking and how they're hiding it. We also have a partnership with Juvenile Court, and so that's a smaller group as well that we're able to really get to talk to the kids who are vaping and hearing from them a little bit more. Of course, they're a little less candid in those conversations at Juvenile Court, but still, we are having those conversations and trying to have more of those conversations as well.
Great. And then as it relates to the Williamson County scores so well in so many ways in health statistics in the state of Tennessee, but the state of Tennessee's 46? We're pretty low when it comes to comparisons for other states. But the provider rates here in Williamson County for mental health, Kathy, we know, and from the folks at Mercy and Refuge Center, there's quite a waiting list for mental health services. Isn't that correct?
Yes, and we've been trying to work. We're definitely working with Mercy. Unfortunately, they have an enormous wait for mental health services. Certainly on our panel, on our Blue Ribbon Task Force, the Suicide Prevention Task Force, we have a representative from Rolling Hills, from the Refuge House, and other behavioral health agencies. So really trying to get a grasp on it and come together. We're starting conversations already with Williamson Medical Center to talk about how we might be able to bring in more mental health counselors into this community. So those conversations have started.
Great. So we're going to wrap up today, and I know they'll be here to answer any questions you may have, or if you want to get in contact with me, I can put you in contact with them. Again, please thank these ladies, but also thank our partners, Williamson Medical Center and Renaissance Bank. So it's our birthday. Did you know that? It's our birthday, actually our anniversary. 2020 is the 20th anniversary of the creation of Franklin Tomorrow by a group of business and community leaders. And we're celebrating throughout the year, and you'll be hearing more about this. Our dip jar is out on the front table there, and take your debit card or credit card and dip it in, and then within 5 seconds, you've donated $20 to celebrate and commemorate the work that Franklin Tomorrow does in our community. And we do this, and again, I cannot thank our partners enough. We're able to do this because we have such great partnerships with the people you saw today, but also the City of Franklin, and we appreciate them being here and recording this, and it will be replayed on the cable channel and on their Facebook. We play it a number of places, so that's important. But we're turning 20 in 2020, and we just need your support and ideas for that. Thank you. Also, you can support Franklin Tomorrow in a number of other ways. We've got our historic Franklin license plate you can get on the back of your car, and we've got other events coming up, but our Mayor's Cup golf tournament in September, that's a fun one for sure. And our upcoming events, the next Frank Talks will be March 9th, and that is going to be City Hall on Wheels at the West Haven Residence Center. That's going to fill up quickly at West Haven. We do have a more of a space limitation there than we do at other places. We also will probably at that occasion be talking a little bit about some of the data, releasing some of that from our On the Table experience in 2019. So we're excited about that. March 21st, don't forget, that's Walk More with the Mayor, and we're going to trash your size. April 13th will be Frank Talks, will be the City Hall training room, and our next Breakfast with the Mayors is April 28th at Rolling Hills Community Church. So we have a number of activities coming up. There's a flyer out on the registration table with some of these dates on it, so you don't have to try to get all those down. But we appreciate you being here today, and thanks so much, and go out and make it a great day.